Ladies, stay tuned because the sexual wellness revolution is here. If you're interested in a safe and effective way to increase your sexual satisfaction, reduce urinary incontinence, and enhance vaginal sensitivity, then stay tuned for this episode.
Lovely introduction. Thank you, Gary.
Welcome, everyone. It's time to Elevate and Thrive here. Of course, we have Dr. Angela Yeagley. We have Dr. Samantha in the house.
Hey. Hi.
Yeah, today we have a cool topic. So we're talking about what happens when you take PRP, platelet-rich plasma, and you inject that into some of the sensitive tissue of the vagina and clitoris.
Yep.
What happens? What is it? What are we talking about?
So mostly what happens is just tissue regeneration and sensitivity is enhanced. So what are you looking for, right? Or what are your main complaints that you would be like, oh, maybe I should try this? Decreased ability to orgasm, or you're taking a longer time to orgasm. You may have had a couple of kids come out of that place down there and are having some issues with overall just function in general. Another thing would be, like Barry mentioned, just urinary incontinence happening as well, right? After we have children pass through the birth canal, all of those tissues get kind of squished and mangled. Sometimes moving back into place is a little bit more difficult, and so the PRP can also help to enhance the integrity of the pelvic floor as well. So you kind of kill two birds with one stone, enhance sexual pleasure while also maintaining overall urinary function or ability to retain urine, say when you're jumping on a trampoline or laughing or sneezing or picking up your kid. That can be helped by doing the PRP injections into the vaginal walls as well as into the clitoral areas.
And I love that you use the word mangled, with giving birth.
I mean,
might be a strong word,
that is
but
what
definitely
happens.
there are changes, right?
what
Changes that
happens.
happened. I think also maybe we want to talk a little bit about what PRP is exactly. Platelet-rich plasma is your own blood. Your platelets are extracted and they are activated to basically take on stem cell-like activity, and so they rejuvenate the area that you inject them into. So that really can be anywhere in your body, but of course in this instance we're talking about injecting it around the clitoris, around areas of the vagina, inside close to the G-spot, and as Dr. Samantha was saying, also, you can do many injections inside to kind of strengthen and tighten that vaginal tissue, which then really does help, with the incontinence or increased stimulation or pleasure, right?
I think too with the PRP, we need to remember that it's the growth factors that are really the big heavy hitters in that PRP, and so we're using your body's own power and ability to heal itself, right? Which again, that comes back to the tenets of naturopathic medicine, right? Use the least invasive force possible, right? And what better way than to use your own body's inherent knowledge to help that happen. We're just adding a little bit of science in with it.
Yeah, absolutely. I know, of course, we're big fans here, right, of PRP and, of course, naturopathic medicine. One thing I also encourage people to do if they're going to do PRP, it's a little side note. I love having people do like IV vitamin therapy before they have their PRP drawn. If we can get, 1 to 3 of those, it's really nice. And then that just makes your blood that much more rich, when we pull it out and activate it. So I think this is exciting. To me, the O-shot is kind of I don't know that there are really that many options for women that maybe are struggling with, having something help them with their sexual wellness or if they're struggling with orgasm or stimulation, things like that.
Yeah, this falls into this great category of expanding options, I think, for women when it comes to both sexual health and just overall wellness. We're seeing this in we're seeing this in the realm of things like menopause, and there's this huge kind of menopause boom going on right now with just more awareness around it, more dialogue around it, more options. You know, obviously we do a lot of treatments with stuff like hormonal factors as women change. You know, again, this falls into that same category of like, let's shine a light, you know, into an area that sometimes has been minimized. You know, when you look at the data, it's kind of interesting in that upwards of 50% of women experience difficulties with orgasms, and with having the frequency, intensity, and quality of orgasms that they want. So about 50% say they're not satisfied. Whereas with guys, it's more like 95% are in the I am having the orgasm zone.
Wow. Well, obviously the mechanics are a little different, you know.
But I'm saying
yeah.
50% is not like a great stat, you know.
No, it's a horrible stat.
What is interesting
Yeah.
too is that data, that number goes up depending on the quality of the relationship.
Exactly.
So there is a correlation for women, obviously, you know, and with, I think, you know, theoretically with everybody. I would say as a man, there's also a correlation between the quality of the relationship and the quality of the orgasm and the frequency and ability to have an orgasm, right? So this is phenomenal though for people who, and for women who find themselves in a spot where, you know, they want to have more. They are looking for a way to help increase the frequency and intensity of their pleasure.
Absolutely.
Absolutely. I think too, getting back into that menopause that you brought up, right? What happens with the vaginal cavity when we get into menopause, right? Decreased lubrication, right? Which then can lead to a whole host of other issues that we deal with. The O shot does help increase that lubrication factor that happens in there. And two, let's not leave out the young gals too, right? Sometimes I'll see some patients that are on multiple SSRIs or things like that, and they're really struggling with their sexual health. SSRIs, one of the common side effects is decreased libido, right? So that is something else that we can bring in to help aid with that while we talk about other things that we can do to help potentially maybe wean them off of some of those medications or bring in some herbal supplements to help with that. So there's not as many side effects. So yes, menopause, but also I'm not going to forget my young gals out there that just want to have some rockin' orgasms. And change lifestyles as we're moving through their healing process as well.
Yeah, I love that. I love that. I mean, I think our takeaway here is that really any woman of any age could benefit from, you know, potentially from having an O shot, especially, I think that, as you mentioned, that there is a huge percentage of women, no matter what their age, although I would say women who are probably older have learned, you know, the things that work for them. And I think that sometimes younger women, that's a little more of the struggle as they're still figuring out like what feels best for them. So I think that, 50% is a very sad number to me, you know, that if there are that many women who are not enjoying themselves or haven't, you know, found a way where they're experiencing, because it should be a very pleasurable thing, right? That experience, you know, sex should be great. So I love that. I feel like for our ladies, you know, anything that we can bring in that, you know, I think women are a little more complicated than men. And I think that's probably why that number is so big as well. You know, I think women, you know, a lot of emotions have to be in place, you know, probably the timing has to be right. So a lot of things that, you know, for men, it's like, it could be dying. It doesn't really matter. They're available, you know. Yeah.
They're just cutting me deep. Right now. They're cutting me deep. I would say this. How I would frame it is that, you know, sexual pleasure, orgasming or whatever, it's a complex topic, right? There's an emotional, there's a physical and kind of mental aspect, right? And all of those things combine to create experience of sexual pleasure and enjoyment for someone, right? So I think when we're looking at a situation though, where it's like, hey, you know, there's this physiological mechanism that maybe can get tuned up or optimized or improved or elevated so that it helps with triggering that physiological part of that equation. You know, whatever that equation is, I think is a little bit different for everybody. I think that's really exciting, right? I mean, this would be this not exactly equivalent, but this is analogous to maybe guys who are experiencing some ED issues, right? And then they're able to find a tool, maybe like a Viagra or a Cialis or something, or the P shot or whatever that can help them cope with that issue. So physiologically now they're coming into it with more confidence. They're coming into it more equipped. And I think this for women can be a similar kind of thing. It can give them more confidence.
Absolutely.
Can increase their sensitivity. Enhance the experience that they're having. Maybe take their orgasm from they're having it 2 out of 10 times to 8 out of 10 times, or they're saying it was on the scale of 1 to 10 that was a 3 orgasm, and now I'm having 9 orgasms. That's great. I mean, who doesn't want that? Dial up the intensity. I love it.
Yeah.
So I'm sure we get a lot of pushback, and Dr. Samantha, you've done a number of these. This is something that we were excited to get you on the show to talk about, because it's not something that we had really offered at the clinic prior to you being here. So, share with us a little bit about some maybe the hesitations that people have and some of the questions that people have when you start having this conversation.
Absolutely. So one of the biggest hesitations is like, oh my gosh, you're going to put a needle where? But just know you are thoroughly numbed up. I will have you come in and void your bladder, and then I'm going to give you some numbing medication that while you're in the bathroom, I'm going to have you put that onto your clitoris. And then I will also do a quick exam of your anatomy to make sure that everything is peachy keen to move forward, right? So a lot of times this will include a very delicate vaginal exam to make sure that there's nothing abnormal before I begin injecting, right? And this can also somewhat be done too while I'm placing the medication, the numbing medication. So numbing medication on the clitoris, and then also within the vaginal vault as well, right? Because there are injections that will be placed there. I will say too that it is dependent upon what the patient is seeking, as far as if it's just sexual health, or if we're also doing not vaginal rejuvenation, but tightening up the pelvic floor as well. So with each procedure, your injections may be different than the previous time based off of your results. And your injections are going to be completely different than somebody else's injections. So it really is tailor-made for what you need. The other thing is, does it work? It does, but you've got to do at least 2 injections before you see the maximum benefit. And also, you can't have sex right after you have these injections. You've got to wait at least 48 hours. I know women are like, well, it should be working right away. I'm like, well, actually, it takes a while for your body to take those growth factors and actually do what it needs to do. So giving adequate time between procedures and adequate time to have the full effect is really important too. This is not a quick fix, but it is using your body's own power to help fix itself. Other questions I get, like, am I going to bleed? There may be a little bit of bleeding, right? I'm injecting into tissues that are heavily vascularized. So there may be a little bit of bleeding, but it's not going to continue on. Other things, what are the sensations afterwards, after I get the injection? You may feel really full, kind of like you need to take a big poop, or you may be having a baby come out. That's just because I injected, depending on your treatment, 3 to 5 cc's of your platelets back into your body. So of course you're going to feel kind of full in that area. Those are the biggest things I see. Really.
I'd probably ask, like, if somebody would probably be curious about pain, like after.
I haven't had anybody report any pain to me, just that sensation of fullness, really. So, those are the big things.
I mean, I think overall, it's actually a very well tolerated procedure.
You're really numb, and there's no needles to numb you too. Right. So you shouldn't
just creams.
There's just creams to numb, which they work really well.
And this is type of thing that we would schedule, and you come in and get your platelet. You have to get your platelets pulled earlier, right? Or
yes.
The day of, right?
Yep.
And then you'd come back in for the procedure, like, say in the afternoon, and that would take.
I mean, ideally, my ideal situation would be we have a specific 30-minute consult to go over your goals and what's going on. We schedule it maybe the next day or the following week. You need to come in 30 minutes for your blood draw, at least 30 to 45 minutes for numbing, and then give me at least 30 minutes for the procedure, just so I can make sure everything is peachy keen. So hour and a half.
Cool.
About for it.
That's a lot of great benefit for hour and a half. And then you're saying typically we're looking at a minimum of 2, maybe 3 treatments over a course of a month.
The 2 treatments, so the first treatment would happen, and then 6 to 8 weeks later, you and I would have a check-in, we'd see how things are going, and perform the second injection at that point in time. Then I'm going to give you a good 3 months or so and see how things are going, and we might need to touch up after that.
I love it. Yeah, I think a good way for people to think about PRP treatments, whether we're using it here in the clitoral area or we're using it for hair restoration or joint restoration or whatever we're doing, is it's more analogous to, say, like a lizard, regenerating or growing its tail. It's a slow process, right?
Yes.
It's stimulating these regenerative factors within the body. It's not like an instantaneous thing. I mean, just think about it. It's creating growth, new kind of connections, right? All this stuff happening, and that stuff, the body doesn't do it instantaneously. It takes time. So just, be thinking you're kind of regrowing this limb, not like it's an instant shot and like all of a sudden a switch is flipped and now you're in orgasm land.
Correct. A clitoris limb.
Oh my gosh.
Does it enhance clitoral size?
You will feel full.
But it doesn't cause clitoral,
but it doesn't cause
swelling.
Does it cause
it's
spontaneous orgasm?
No. It's not.
I had to ask.
I mean, maybe if like your pants are like rubbing weird. I don't know.
Oh, yeah, well, you lose control of your ability to not have an orgasm.
Walking down the street. No, I'm just kidding.
I think
that won't happen.
A line out the door.
You have to have stimulation.
Will it turn
still.
you into a nymphomaniac?
Yeah.
I mean, dear Lord, I hope not. We do not need those people walking around the streets. Have you seen what walks around the streets now? Online dating is scary. I will just tell you that. Anyways, it should not be doing that. You still need to have physical rubbing, stimulation of the clitoris. After the procedure, you are going to feel full. It's going to feel kind of
puffy.
Ooh, poofy. Yeah. But it's not something that's going to last for forever.
Well, and I hope if you're listening, like that this isn't awkward, but Dr. Samantha has offered to do mine. So I will report back and give feedback on how that goes. We will see. Yes.
We'll do a future episode. That's the follow-up episode. I do actually love when we have an opportunity to do a follow-up episode from an earlier episode where we can report back. But this was great. I mean, this is a phenomenal process, a great procedure. I'm so excited that we're able to offer it here for people. And I'm a big believer, as I hope everyone is, in empowering people to really have an incredible life. And sexual wellness and happiness and satisfaction is a big part of having a happy, healthy, awesome human life. So highly encourage those people out there who might hear this, listen to this, and if it's something you've been struggling with, and maybe it's not even something you've talked to a lot of people about. I know a lot of people who are in who are long-term relationships, and over time the sexual chemistry and the sexual, magic,
the fire, the robustness of it
has faded. And I know that sometimes it feels like a burden on a person. They're like, maybe there's something wrong with me, or maybe there's nothing I can do about it. And this is certainly one of many different avenues that we can explore that may be the right avenue for you. I mean, libido is a complex thing.
Yes.
A lot of times when we're treating low libido, we are looking at the overall picture of the human person, their hormones, their kind of all the other various factors that are going on there to say, okay, what can we do to get you in a spot where you're feeling like yourself and you're feeling normal and you're feeling a healthy sexual drive. And this certainly is something that we can look at as well.
It's one tool in a vast toolbox that we possess as naturopathic physicians, right? So it's one thing we can do. And when you come see us here at Sage, right, we're not going to just be like, here's your one thing to do. We're going to look at everything to support you, right? I want my girls having some good orgasms. Women deserve it. They work way too hard and get the short end of the stick when it comes to sex. And I think that for me as a physician, this is one way I can help to change that for women, to make them realize like your sex life is just as important as your partner's.
Absolutely.
And even more so. We can get onto that.
Even more so.
We can get onto that topic later. I got a lot to say about that, but yeah.
Dr. Samantha, thank you for being here. Thanks for bringing the heat on this. And we are excited to offer this procedure here at the clinic. So if something you're interested in, give us a call, schedule a consult with us online, and we're happy to help you.
Very happy.
Until the next one, elevate and thrive.